Hi, Ellie Glazer here with this week's Surveyor video podcast. Thanks for tuning in. I have a question for you. What do you think is a more dangerous weapon? A handgun or a fork and knife? Well, if you said the obvious answer, a handgun, you would be woefully incorrect. Last year, handguns killed 40,000 Americans. Forks and knives killed almost 400,000 Americans last year. That's right, 400,000 as opposed to 40,000. That's a big difference. And many of us aren't really even aware of it. It's a blind spot that so many of us have, yet so many of us cause this self-inflicted wound. I want to share with you a recent article that was in the Wall Street Journal that really brings this idea to life. The headline is Heart Attack at 49. America's biggest killer makes a deadly comeback. Younger people, women and non-smokers are more likely to be victims of the crisis of cardiovascular health driven by skyrocketing obesity and diabetes. Now, one of America's greatest achievements over the past century has been a huge decline in death rates from heart disease and strokes. Anti-smoking campaigns, medications to control blood pressure and cholesterol, and surgical advances have extended the lives of millions of people, fundamentally reshaping the United States population. But now, according to researchers, progress has stalled. And that's helping drive down life expectancy in the United States after decades in which each generation of Americans could expect to live longer than the ones that came before them. Our children were always anticipated and expected and usually lived longer than the parents. Not anymore. And particularly alarming is the death rate is actually rising most among middle-aged Americans. Now, heart disease was once on course to fall below cancer as the nation's leading cause of death. And that was a change that public health statisticians most recently predicted would occur within a few months by 2020. But that's not the case anymore. According to the Center for Disease Control and Prevention, it's highly unlikely now, given the current trend of obesity and diabetes, that there will be crossover anytime soon. Meaning that heart disease, the primary cause of which is obesity, is still hovering high above cancer as the number one cause of preventative death in the United States. And the obesity epidemic and related relevance in the prevalence of type 2 diabetes are key culprits in this new wave of cardiovascular disease mortality. Researchers have been sharing this for years and years. But this new headline just really emphasizes and brings new light to this very sobering subject. It's really a major driver, said Stephen Sidney. He's the director of research clinics at the Kaiser Permanente Northern California Division of Research. Obesity began rising across the U.S. in the early 1980s, and type 2 diabetes rates accelerated several years later. And that has given both enough time, he says, to really impact in a negative way on the entire population. Now hear this. Nearly 40% of Americans aged 20 or over are obese. 40% are obese. Another 32% are overweight. That means if you see 10 people on the street, the average of them 4 are going to be obese and another 3 are going to be overweight. And that's unbelievable. And the consequences, as we're saying, are just astronomical. And it's eroding the enormous gains brought on by public health campaigns against smoking, medical innovations, such as cholesterol-lowering statin drugs. Right? Those were introduced in the 1980s, and that helped prevent millions of Americans from developing life-threatening blockages in their blood vessels that can cause heart attacks. But today's heart disease victim is vastly different from the classic patient doctors and the public were trained to recognize just a few decades ago. That person used to be a smoker, usually male, whose LDL or bad cholesterol numbers were sky high. Now, the patients are younger, more obese, much less likely to be smokers, include more women. And here's the key thing, my friends, please take this to heart if nothing else. Many are unaware that they are at risk. We all have a blind spot, but our forks and knives are killing us individually and nationally more than all of the handguns out there. Now, this issue strikes a personal resonance with me, as many of you know that my best friend for the last almost 30 years, Mike Stern, tragically passed away from a heart attack 33 days ago. He was a big guy with a huge heart. And he wasn't a bad guy. He wasn't even a good guy. He was a great guy. But great people can have blind spots. And that blind spot can really kill us and cause horrible tragedy for our family and our friends and our community. So please take this to heart. Look at your fork and knife with the seriousness that it entails. And if you're one of the people in the majority, not in the minority, but the majority who are using our fork and knife to otherwise cause us to be unhealthy, either overweight or obese, with all the requisite medical symptoms and indicators, whether we're aware of them or not, whether they're showing up in our blood work currently or not, please make a change. For yourself mostly, but also for your family, for your friends, for your community. Don't get killed by that blind spot. Put down the fork and knife and pick up your life. Thanks for tuning in and wishing everyone a great week.